So even when you feel fine, there is no dizziness, no headache, things may still be going wrong inside, right?
95% of patients who are having high blood pressure, they do not have any symptoms. So only 5% of patients who are having hypertension, they will have symptoms.
What about ghee? People say घर का घी तो healthy होता है.
Ghee is from the animal source. It is having a high cholesterol. Excess weight is one of the reason for the high blood pressure. People who want to control their blood pressure, they should decrease the weight. Somebody is trying to decrease the weight, they should not consume excess ghee.
Namaste dosto. This is Prakriti and I welcome you all to Heart, a place where we are going to talk about one of the most important engine of our body, that is our heart. Let me start with asking you all a very simple question. Have you ever said that I am feeling fine? I don't think anything else is wrong with me? Well, I have said that a lot of times, and so has my family. But the truth is that feeling fine does not actually means that you are fine, especially when we talk about blood pressure, or as our doctors call it, hypertension. Unfortunately, India is becoming the capital of hypertension in the entire world. Most of the people are suffering from it and they don't even know because it has no signs, no alarms. It is silently killing us. It is destroying our brains, our heart, and our kidneys. So, how we are going to fight about it? Well, it is very easy with two very easy components of our life, that is our thali and our shoes. Yes, our diet and exercise. And I'm so happy to have with us today Dr. Vithal D. Bagi, a senior cardiologist who believes in solving real life problems with real life solutions. Thank you so much, sir, for gracing us with your presence today. Let's start right there, doctor, because I know people who think blood pressure is just अरे थोड़ा टेंशन हो गया ना इसलिए बढ़ गया. But medically speaking, what is exactly hypertension?
Yeah, heart is the main engine for the whole body. When heart pumps the blood, the pressure with which the heart generate to pump the blood is called one kick. With that, the blood has to circulate the entire body. It has to come back to the heart. So it is one kick from the heart. The blood has to go from head till the toes, and it should again comes back to the heart. So it is a one circulation it should take from one kick from the heart. So the amount of pressure generated by the heart is known as the intraventricular pressure, or the same amount of pressure is exerted on the blood vessels of the body. It is called blood pressure or the circulatory pressure. So if the blood pressure is 120 bar 80 millimeter of mercury, it is called as normal blood pressure. If it is more than 140 and 90 millimeter of mercury, it is called as high blood pressure or hypertension. Between these two, we can say pre-hypertensive or borderline hypertensive or stage 1 hypertension based on different guidelines.
Hmm. So it is not about any temporary tension or emotions?
Yes, ma'am. Actually, if somebody is having a baseline blood pressure of 120 bar 80 millimeter of mercury, if he climbs the steps, or if he go to the doctor's clinic, or if he has a temporary stress or worries, that time the blood pressure can go high, like it can become 150 or 160. The moment the temporary stress comes down, again the BP will come back to the baseline. The temporary emotions or temporary stress can also increase the blood pressure. That is not called as hypertension. But if somebody is having a consistent blood pressure of more than 140 and 90, any time of the day or any time of the week, any time you check the blood pressure, it is called as chronic hypertension or high blood pressure.
I see, I see. So even when you feel fine, there is no dizziness, no headache, things may still be going wrong inside, right?
Yeah, 95% of patients who are having high blood pressure, they do not have any symptoms. So only 5% of patients who are having hypertension, they will have symptoms. So if the BP persists more than 140 and more than 90 for 5 or 10 years without noticed, without being diagnosed, that will lead to a damage to the organs like heart, brain, eyes and kidneys and blood vessels. Suppose imagine the heart has to generate 120 millimeter of mercury pressure. If it is subjected to 160 for every beat, every second for 10 years, there is a more workload on the heart. So the heart undergoes a kind of increase in the heart muscle thickness called as hypertrophy. Similarly, the blood vessels go for a stiffness, and there will be narrowing of the blood vessels of the eye leading to blindness. There will be a loss of protein in the urine, and that may lead to kidney failure. Sometime there might be a bleeding in the brain or the clot formation bleeding leading to stroke. So if BFI is not diagnosed, if you are waiting for the symptom to happen, it is already been late, because you will end up with complications of the blood pressure. So instead of that, have a regular checkup for the blood pressure. It is a silent killer. It doesn't cause symptoms in 95% of patients. So if you want to really diagnose hypertension, check the blood pressure by uh, the mercury manometer or the digital apparatus, and if it is more than 140 and 90 above, always you are hypertensive irrespective of whether you have a symptoms or not. So only 5% of patients can have headache, giddiness, they will have sometimes bleeding from the nose, or they may have a kind of irritability. We say they may be having symptoms of hypertension.
Wow, that really hits hard. I mean, we go about our life without checking, thinking we all are okay, but blood pressure, it doesn't shout, it whispers, and it kills you silently. Okay, so now let's talk about food, because in Indian household, food is both love and danger. So when someone is told that they have high blood pressure, what is the first thing that they need to change in their diet?
Yeah, uh, diet is both a culture, it is an emotion, it is a habit, or it can say it is a medicine, or sometimes it can be a poison if it is taken in excess. So in the diet, salt particularly, as for the recommendation, 1 teaspoon of salt is required per day per person. That means less than 5 gram of salt per day is required. But most of the Indian diet contains 9 to 10 gram of salt per day. We're almost taking double the required dose of salt in the food. So we eat lot of spicy food. We add more salt. The processed food or the fried items, they contain excess of salt. So excess salt intake is one of the reason for the high blood pressure. We say limit white. If you decrease the excess salt and excess sugar, you are going to decrease the overweight. You are going to decrease the blood pressure.
So it is not just the salt we sprinkle, right?
No, no, it is not just the salt which is added to the diet. There is something called as hidden salt. Suppose if you take the breads or the processed food or the packaged food, salt is used as a preservative for the food. So the hidden salt in all these items, biscuits, breads, or the processed packaged foods, they all contain salt as a preservative. So knowingly, unknowingly, we consume more salt along with the dietary salt what we take from the food. So when you are going for the processed or packaged food, always check the package, check how much salt it contains. So more than 5 gram of salt is not allowed for any person at any age.
Bread? I didn't expected that.
No, no, no. It is another myth. See, the the food habits are the we have a lot of Indian dishes for that for example. So they have evolved over a period of centuries or generations. Okay, so we do not have to starve our taste buds. Anything is in excess is not good. So I told restrict the salt. I never told do not take salt. So similarly, it's we commonly say we have to take everything with a pinch of salt. Similarly, when you are choosing the food, we should choose the food which is balanced, having 50% carbohydrates, 30% protein, and 10 to 15% fat. Along with that, minimum amount of the spices and the salt, not in excess. So anything in excess is poison, including medicines. So when you're taking the food as a medicine, or if you are making the choices for the food, choose the food which are indigenous, which are culturally rooted, which are balanced, not the fried or the fast food or the junk food. And also when you are using the food, you can use to enhance the taste of the food. Instead of salt, you can use ginger, lemon, or jeera, because they also add to the taste, but they do not contain salt. So you not have to starve your taste buds. You can eat tasty food, you can eat cultural rooted food, you can eat the indigenous food, but do not add excess spices, excess salt, or excess oil, or don't make it deep fried, something like that.
So we don't have to starve or only eat boiled food.
No. So the food is a medicine. You should eat banana and coconut water and fruits which are rich in potassium and calcium, because excess intake of potassium calcium will decrease the blood pressure. So when you're using the food, you consume a lot of vegetables and fruits which are rich in potassium and calcium, which will help you to decrease the blood pressure by 2 to 4 millimeter mercury.
Hmm. So the food should not be sad in order to be healthy. Now, doctor, I want to bring up some questions our listeners sent in. These are the things which we all wonder but we rarely ask. So, here we go. The first question is, my mom makes homemade mango pickle every year. Can I eat it in moderations?
Yes, I told the hidden salt. So the salt what we take in the food is which is added for the preparation of the food, whereas pickle, papad, and the chutneys, they contain excess salt. Even the homemade pickle also has excess salt and oil. So once in a while it is okay to consume pickle, but not as a staple food. Staple food means the food what you eat every day, three times a meal, like breakfast, lunch, dinner. So every meal should not contain pickle, or every day it should not contain pickle. So once in a while you can have a pickle. Once in a while you can have sweets when festivals are there, but it is not used as a regular staple food.
The next question is, what about ghee? People say घर का घी तो healthy होता है.
Yeah, again, ghee is from the animal source. It is having a high cholesterol. Excess weight is one of the reason for the high blood pressure. People who want to control their blood pressure, they should decrease the weight. Somebody is trying to decrease the weight, they should not consume excess ghee. And once in a while, one spoon of ghee is okay, but not as a daily added food, added taste enhancer for the food. So once in a while you can take for a ghee, but not as a daily regular food. Particularly if you are planning to lose the weight, do not consume excess ghee, it will add to weight.
Is coconut water really helpful?
True, coconut water is rich in potassium. Potassium is another mineral in the food which will decrease the blood pressure. It has a lot of heart related and blood vessel related benefits. So coconut water is definitely healthy, but do not add excess sugar or additional things to the coconut water. Consume it is as natural as possible. Coconut water, banana, I told, and even the fruits, vegetables which are rich in potassium, they are good for the health as well as for the blood pressure.
So the next question is, if I skip breakfast, is that harmful for blood pressure?
Yeah, we should have a routine. Routine means timely food, regular timing for the breakfast, lunch, dinner. If you do not take timely food, our biological or circadian rhythm get affected. Means people who take breakfast at one time, 8 o'clock one day, another time 11 o'clock, they will have a lot of acidity issues. If you're having acidity or hunger cramps, your stress levels will go high, your BP will increase. So you should have a disciplined life, regular food habits. Timely food is also important to maintain the stress levels and also to maintain the blood pressure.
I see. So consistency matters most than the occasional treats.
Yes.
Okay, now let's go to movement. Most of us live such an inactive lifestyle now. Office chair, long commutes, scrolling on sofa. How much does that contribute towards hypertension, sir?
Yeah. See, if I want to build the muscles, I should biceps, for example, I should use the dumbbells and I can flex and relax like this. Similarly, the blood vessels and the heart, if you want the heart to contract better or the blood vessels to dilate and constrict, they need to be regulated. So if you are doing a regular exercise, there will be a dilation of the blood vessel and constriction of the blood vessel, which will help to allow the blood in a good manner. It will also release something called as good hormones in the body, like vagal tone or acetylcholine, which will decrease the blood pressure, decrease the heart rate, and decrease the stress level. So regular exercise is very good. We often say athlete heart, people who are doing regular exercise, their heart rate will be on the lower side, their BP will be on the lower side, and they are having a better ability to handle the stress. So regular exercise helps in maintaining the blood vessel health. Like similar to the skin health, the blood vessels have got a lining called as endothelium. The endothelial health is important for prevention of all these blockages or the heart attacks and strokes and all. So to maintain that blood vessel health or endothelial health, exercise is an important tool which will make the blood vessels to dilate and constrict, and also helps the blood vessels to release good hormones in the body.
So you don't need a gym membership.
Yeah, so suppose if you want to build a body or muscles, you can go for the gym. But other way also, if you walk for 30 to 45 minutes per day, 5 days in a week, there is a minimum required exercise to maintain the good health. So if somebody wants to walk for 2 hours per day, yes, it should be encouraged. But what is the minimum amount of exercise to be done every day? It is at least 30 minutes of walking. 5 days in a week is a minimum required exercise to maintain the blood pressure or the good health.
What about people who are over the age of 60, like if they have knees issue or something?
Yeah, see, hypertension is genetically related. If there's a genetic predisposition, they can develop high blood pressure. Increasing age is also a risk factor for the high blood pressure. So, people who are above 60 years, most of them usually have a high blood pressure, and they will also have arthritis. They can't able to walk because of the knee pain. For them, they can do yoga, or even chair yoga is okay, or even they can do a cycling sitting on the chair. Swimming is good for them because it doesn't put a weight on the joints. So there are other methods of exercise they can do at home, based on their ability, based on their strength. But any amount of exercise is good for the health. At least 30 minutes of exercise per day is good for the health.
I have noticed like when I take even a 15 minutes walk after lunch, I feel lighter, more clear headed.
True. Um, Walking after the lunch, I'll tell you, the fatty meal what we take, there's something called as triglyceride. They do not go to the liver from the intestine, they directly go to the bloodstream. So walking after meal, it will help to use the skeletal muscles of the body, the muscles of the body which utilize the triglyceride. So that will help to decrease the weight, and also it will help to improve the insulin secretion. It also has got a good metabolic benefits. So walking 10-15 minutes after having a meal is a very good habit. It should be continued.
Doctor, can we talk about stress and sleep? Because I have noticed when I don't sleep well or I am anxious, my body feels very tense.
This is a very important question. The recent guidelines for the management of high blood pressure, they have clearly mentioned that 7 to 9 hours of uninterrupted sleep is also one of the recommendation. Means sleep is as important as food and exercise. So if you have a disturbed sleep, you will develop hypertension. So at least 7 to 9 hours of uninterrupted sleep is important. The other factor is stress. See, normally we have something called as stress hormone in the body. It's called adrenaline. In all animals, the adrenaline is secreted in three situations: fear, fight, and flight reaction. Means if I want to fight with somebody, my adrenaline levels will go high, or if I'm having fear, my adrenaline levels will go high, or if I want to run away from the situation, my adrenaline levels will go high. But we human beings, because of the thought process, we are we have a unrealistic goals. We're chasing a lot of dreams. We unnecessarily think too much, which will lead to excess adrenaline secretion in the body, which will increase the heart rate, increase the blood pressure, increase the blood glucose, increase the blood cholesterol, and all. So we should have the contempt in life. Like we should have the peaceful life. We can have a kind of a peaceful sleep. Suppose if you are having a uninterrupted sleep for 7 to 9 hours, you are the healthier person. So the more stress you take, there will be more adrenal hormone in the body, and the less duration of sleep increases the stress hormones like cortisol and other hormones in the body, which will increase the blood pressure. Managing stress is also an art. Like many people, even though they sleep with a sleeping pill or after drinking alcohol, but they were not able to handle the stress in day-to-day life. So managing stress is an important factor which can reduce our blood pressure. So organize yourself, give a priority for the health and the family, and also dedicate certain hours for the work, certain hours for the family, and certain hours for the sleep. Watching electronic devices after 8 o'clock, after 9 o'clock, which will stimulate the eyes and the brain feels that still it's the daytime, so you don't get sleep. So when you go to the bed after 9 or 10 o'clock, do not watch electronic devices, do not stimulate the eyes or the brain with light, so that you will get a good sleep. Even taking 5 to 10 deep breaths before sleeping is going to induce sleep very well. In some individuals who are having a long duration of lack of sleep, they can consult the psychiatrist or the physicians. They can take a sleeping pill for a short time till the biological cycle gets regulated. After that, they can have a natural sleep.
So we have to focus on diet and exercise, but with that, rest is also therapy, isn't it? Okay, so doctor, now, if you have to give three golden rules to someone who has been newly diagnosed with hypertension, what would you say?
Monitor your blood pressure regularly. Periodic checking of blood pressure is important, either in the clinic or at home with a digital apparatus. And walk regularly and maintain the good choices in food. Do not take anything in excess. Also have a rest and 7 to 9 hours of uninterrupted sleep. These are the tips for maintaining the good health and controlling the blood pressure.
Thank you so much, Dr. Vithal Bagi, for your knowledgeful insight and wisdom.
Thank you, everyone. Thank you.
Now, to my lovely listeners, don't wait for a warning sign. Eat mindfully, walk with purpose, breathe, sleep, and repeat. Because that is how we lower the blood pressure and raise the quality of our life. This is Prakriti signing off from Heart to Heart. Until next time, stay heart wise and share this episode with someone you really care about.